In this episode of Ask Dr. Zach,
my eyes are really dry. They hurt. I'm constantly struggling with something. I'm hoping Dr. Zach can answer some of my questions about how to make my everyday living a little bit easier.
I can hardly make it up these stairs because of the arthritis in my legs. It is painful for me to take every single step. Ow! It's very hard for me to walk in those high heels.
You're taking too many drugs. Many visits to the emergency department are just because of drug side effects. In the ER, I deal with trauma and life-threatening situations every day. I've seen it all. I know firsthand that accurate medical advice can save lives. I'm Dr. Zach, and I'm passionate about empowering people to take control of their own health. This is your chance to ask me health questions. No question too big, no question too small. We all know that the eyes are the windows to the soul, but what happens when your eyes become a serious cause of discomfort and pain for you on a daily basis? Many times, problems with the eyes are related to allergies. Unfortunately, this is not always the case, and medical care may need to be provided. To learn more about the eyes, let's take a look at the Blazon medical animation.
The eye is the organ of sight. Photoreceptors in the retina detect light and convert it into electrochemical signals, which are sent to the brain via the optic nerve.
And we'll be right back with much more about eye health.
My eyes are really dry. They hurt. I'm constantly struggling with something. My eyes are really dry. They hurt, feel like I grit in the sand in it, and I have to constantly put eye drops in them because I don't produce tears. Well, I often put in eye drops sometimes every 10 minutes, could be an hour. So it's been an ongoing struggle for about the last 10 years at least. The other thing I want to talk to Dr. Zach about is I have dry mouth. It gets really, really dry, and I am constantly carrying a water bottle with me. Well, this has affected my life a lot because I have trouble with computer work. I get really dry and I have trouble focusing. I get really tired because I'm constantly struggling with something in between my eyebrows. It's just that the eyes sometimes are just really sore. I'm hoping Dr. Zach can answer some of my questions about how to make my everyday living a little bit easier. Maybe there's some new medication that'll combat the dryness in my eyes and in my mouth.
now it's time to ask Dr. Zach.
Welcome, Ida.
Hi.
Thank you very much for being here.
Oh, you're welcome. Thanks for having me.
It's a pleasure. So today we're talking about the eyes primarily. So you've had, is it Sjogren's syndrome that you've suffered from?
Sjogren's syndrome is my secondary system.
Okay.
My primary is PBC,
Okay.
which causes dryness.
Specifically with respect to the eyes, the Sjogren's is known to basically autoimmune disorder, which attacks the glands that lubricate. So basically that cause tears in the eyes and also saliva in the mouth. So the typical things are dry eyes and dry mouth. Is that what you've experienced?
Yes.
Yes. Hence the water, eh? When were you diagnosed?
Well, I was diagnosed with PBC about 10 years ago. I've had a hearing problem for a while, it'll be 30 years now, but my tear ducts weren't working. We discovered about 8 years ago or so.
Okay.
And so as of 7 years ago, I haven't been able to cry.
Oh, really?
And so we went to do some exploratory, and I did the Sjogren's syndrome assessment.
Yes.
And it's secondary. I have it, but
Okay.
it's not full blown, which is a good thing.
Yeah.
Yeah.
Do you get a lot of discomfort in the eyes? Do they get scratchy or dry?
Tons.
Yeah.
I'm working with my optometrist. She's been really good with me, and she tried different things. The ophthalmologist recommended Terra Tears, so I take the Terra Tears.
Yeah.
I've been taking Restasis. I didn't have it with me. It's
Yes.
a medication that I got it. It was approved, what, about 3 or 4 years ago?
Something like
5?
that, yeah.
I got it immediately, and she says it helps produce what my eyes don't produce.
Yeah.
It's scratchy a lot. I got dry bits all over the cornea.
Yeah.
Recently, it's so bad that I got an infection,
Oh, yeah.
and so I'm taking some more medication to help.
So then, actually, the number one probably treatment specifically for the eyes is artificial tears, which definitely you're using. You use a lot of lubricant.
She said Restasis plus the artificial
Yes.
tears.
Yeah. So Restasis actually acts by hopefully counteracting the effect of the Sjogren's to help the tear duct or the tear gland actually make some tears, hopefully.
Mine doesn't make any.
Fair enough. And you were saying, so the ducts where the tears actually get collected, sometimes they will actually plug those. I don't know if they ever talked to you about that.
We tried the plug. We didn't think it worked at all.
No way. Okay.
I didn't feel it made much difference. And they have this new contact lens,
Okay. Yeah.
which you fill with liquid,
Yeah.
and then you put it in this way. So I got them, but I can't fit them in my eye.
Do you have the dry mouth too, or is it just the eyes? You do, eh? So aside from drinking water, do you do anything else for that?
Yeah. I use biotin mouth spray. That really helps.
Good.
I need to use, they say I should use Prevident toothpaste,
Okay.
which gives you, what is it, the fluoride or something, something
Yeah.
they give you to help them out, because the saliva glands don't work, so you don't have the saliva to help counteract the bacteria.
The other thing you mentioned, which is important, is when you have a dry mouth, a lot of the time you have to be careful for cavities because, yeah, it gives the bacteria more
Careful
chance.
for what?
Cavities.
Yeah.
Yeah. So I think it sounds like you take good care to floss and to
I
brush.
get regular, I do that, but I also do regular cleaning of the dental cleaning.
Yeah.
Yeah, I have to do that, yeah. It helps a lot, but flossing is a big thing.
Yeah. And you
Yeah,
drink a lot.
especially with Prevident.
Uh-huh.
The doctor said I shouldn't drink so much water because, you're going to the washroom all the time. I said, yeah, but water helps. Liquid, I don't like sugared drinks, though.
No. Are you sensitive to smoke?
In my eyes, oh, yes. In my eyes, yeah.
Yeah. That's what I
I mean, you try to cover from it, but yeah, I don't like smoke in my eyes, yeah.
Do you take any medications? There are, I'm sure you know, there are some medications, like oral medications, that some people take for Sjogren's or for primary biliary sclerosis.
Oh, I do take for BBC, I take Cresodial, it works.
Oh, yeah, good.
It's lowered my enzyme count to normal,
Oh, good.
so I don't need a liver transplant.
Oh, that's great.
That works. My doctor recommended 1 to 2 glasses of alcohol a month.
Oh, yeah?
So months ago with nothing, so I don't drink much, so I'm okay.
Yeah.
But alcohol does dry you.
And ursodiol, it's a good one. Unlike some of the medications are immunosuppressants, like they'll put people on things that kind of suppress the immune system, because these, as you probably know, these diseases are related to autoimmune function. So your immune system kind of attacks itself or parts of the body.
That's what it did, yeah.
But the immune suppressants they're rough, because they also give you increased risk for infections and stuff. But ursodiol is not an immune suppressant, so I'm happy to hear that it's kind of stopped the progression of the PBC.
Now, Dr. Zach's prognosis.
Maida suffers from dry eyes from her Sjogren's disease. The main things she can do are, aside from the medication she's being prescribed, she needs to increase the humidity in her home. She needs to use some lubricants for her eyes. And for her mouth, for the dryness in her mouth, I would recommend she chew either sugarless gum or hard candies. And she is managing her illness quite well. It's going to be a chronic illness. She has to know that, and she's got to make the best of it. Today we're discussing arthritis. Millions of people live with a form of arthritis. It's a disease of the joints, and symptoms include joint pain and swelling. Osteoarthritis is the most common form of arthritis. Let's learn a little bit more and take a look at the Blosson medical animation.
In order to understand the changes that occur in the joints of a person with osteoarthritis, it is necessary to first understand how joints work. The two main bones of the knee are the femur and the tibia. In a normal knee joint, the connecting surfaces of these two bones are covered with cartilage, a smooth and strong material that cushions the impact between the bones. The joint is also surrounded by synovial fluid, which aids in joint mobility. In people with osteoarthritis, there is a chronic degenerative loss of cartilage, resulting in bone-to-bone exposure, bone destruction, inflammation, and pain. Osteoarthritis can affect any joint in the body and is commonly found in the neck, back, and hips. The cause of osteoarthritis is unknown, but aging plays a significant role in the development of this condition.
And we'll be right back to speak with a few people who suffer from arthritis and talk more about it.
Up next,
I can hardly make it up these stairs because of the arthritis in my legs. It is painful for me to take every single step. Ow!
all this and more right after this short break.
My knees hurt here and above and below. I can hardly make it up these stairs, and this is a beautiful wooded area right beside where I live. This is a park I used to go to all the time, running up and down these stairs. And right now, because of the arthritis in my legs, it is painful for me to take every single step. I'm having to hold on with two hands. Sometimes I have to wear high heels for work or for an interview or for a business meeting, and it's very hard for me to walk in those high heels. Ow! So I'm just hoping we're in a boardroom, we're sitting down, and they're not having to watch me walk in and out. Also in the evening, you're wearing a very fancy dress, you're at an event or a charity. You don't want to wear flat shoes. I'm trying to cross a street, they're not even stopping for me. And now I see the numbers coming. I don't even know if I can make it in time. I just have to hope that the drivers are kind enough not to run me over when the zero comes up. It's limiting my mobility, and I don't know if there's anything I can do about it. I don't want surgery, and that's what I'm going to be asking the doctor about when I get to see him.
Now it's time to ask Dr. Zach.
Thank you so much for being here. So you're suffering, your knees are suffering, and that's limiting your ability to get around and your quality of life.
It is, definitely.
How long has it been going on?
I think I started running when I was about 25, but I'd never run before. And I decided I'm just going to run like a 10K.
Okay.
And so that did it. Then they started hurting after that. Then I had multiple ski accidents.
Oh dear.
Well, you know, and I had is it the MCL or
Yep.
that joint toasted, and I went to a physiotherapist, no help. I had the injections in my knees. What's that? What do they put? Steroids, cortisone? I don't know.
Most common is steroids, yeah.
Yeah.
Cortisone is a steroid.
Yeah, so for like 5 minutes or a day, my knees felt great. I felt wonderful. Then it wears off.
Yeah.
You know, I don't think there's anything. I would love if you could help me find a way for my knees to feel better, because they're creaking and I'm slow walking, and it makes me feel older.
Yeah.
So
absolutely.
it's really limiting me in so many ways.
Well, we're going to try.
Okay, good.
So you mentioned you've had the injections.
Yes.
And by the way, is it osteoarthritis? Have they given you a diagnosis?
No,
Do you
they
know?
haven't. I went to the arthritis hospital,
Yeah.
and they put you through all these tests,
Sure.
walk around the hospital 18 times and tell me if it hurts. Well, yeah, second time it hurts.
Yeah.
You know, keep walking. So, no, they said, well, we'll get back to you, right?
Uh-huh.
So, but I don't think it was it was just on borderline, not serious enough to ask for a knee surgery, ask me if I wanted a knee surgery,
Yeah.
but serious enough to see that I was in pain.
So what did they recommend? Aside from injections, anything
They
else?
said build up the muscles around the knee.
Which is good advice, you know, I'm sure you've tried, because the thinking behind that is that the more you have musculature around it, the less strain it actually puts on the knee joint itself. And have you tried anything else? You mentioned exercise, you mentioned injections, any medications at all?
Medications they're hesitant to give me, because how do you give someone a medication that just bypasses all those body parts and just goes right to that knee?
You're right. You know, and that's true. The problem with any medication you take by the mouth is it's systemic, you know, it goes in your whole body. And so I understand people not being too keen. On the other hand, you know, it's really limiting. So maybe that a medication would help you. There's a couple of things I can think of. Exercise is one. Now, with respect to exercise, did you actually work with like a physiotherapist?
I did.
Okay.
Yes, I did. And I had acupuncture. I mean, I have
you've
done
done-
everything.
yeah.
I've done everything I possibly can.
Good. You mentioned like local therapy, like you had the injection. Did you ever have an injection of what they call viscosupplementation? It's basically injecting like an artificial cartilage to give the area some more some more cushioning.
Whoa, no. If I
help.
could remember that, I would mention it to my doctor.
I'll write it down. I'll write it down for you. Because it's worth a try. And
Yes.
unfortunately, I mean, the steroid injections are supposed to last more than a day or two. But
Yeah.
you know, and some people, they just don't, you know.
I know.
But they're supposed to last months.
Yeah, well, are you supposed to go in like every couple of months and have steroid, and then all of a sudden it starts hurting, you get steroids again? And
Well, some people do it regularly. You can't do it more than about every 3 months.
Yeah.
Because it can actually, too much steroids do have side effects. And if
I
you have too
know.
much of them, it can actually cause problems, and it can also cause breakdown. And you mentioned you'd had trouble with your MCL in the past, so you don't want too much. And you mentioned the high heels.
Yeah.
I mean, high heels are I'm not a big fan. Personally, I think running shoes, or at least, you know, comfortable shoes. Actually, for knee and hip problems, they do recommend certainly comfortable shoes, not high heels, and also well padded shoes. Because any kind of padding you can add
Yeah.
that doesn't, because you're missing some padding potentially in your knees, can potentially help them.
how about what the podiatrists recommend, the orthotics?
Yeah. And
What
some
about
people, some people it helps for sure.
Yeah.
It really depends on, because sometimes arthritis is actually due to a fact that there's a little bit of malalignment.
I think so.
Oh yeah, yeah. Some people do have joints that they call it either you can be bow-legged, or you know. So
I'm a splay-footed, I think. So my knees go down like this, and then my feet go eek.
Oh yeah. So there's basically the doctor terms for it is varus or valgus, but basically if they're not even, if you're not putting the pressure directly on both sides of the knees, then it causes more strain on one side.
Yes.
And orthotics can help with that by building up one side so the knees are not being pressured all the time. So one thing I would say, Kristine, is don't give up. Never give up, you know?
Yes.
I mean, you're healthy, you're young, you know, you have many, many years. You have to keep trying. And unfortunately, especially for things like arthritis, it often ends up being a process of elimination. And sometimes it's frustrating because it takes a long time, but there is something, you know, there's something that'll help everyone.
Oh, good.
And so we're going to get there. Now, I think it probably would be a good idea. I know you're not a big medication person, and I'm not trying to push them, but at least to take some kind of painkiller, even just acetaminophen, aka Tylenol, regularly, just to give you, because you do need at least the pain control for long enough that you can do your activities of daily living and get some exercise in.
That's a brilliant idea.
Oh, well, thank you very much.
You're welcome.
and there are other medications as well. If you can take anti-inflammatories, in some people they're very, very helpful. There are potential side effects like any medication, so you have to talk to your doctor about what's good for you. Well, we got to get you back to the point where at least you can walk quickly up and down
That
the
would be
stairs.
lovely. I would love that.
Okay, great.
Now, Dr. Zach's prognosis.
Kristine has arthritis, specifically of the knees. So if we look at our friend over here, basically the cartilage, which is a soft tissue between the bones, the big bones in the knee, has run out. So now the bones are rubbing against each other, and that's causing a lot of pain. I have two recommendations for Kristine. Number one, stop with the high heels. They're not helping her, they're making her worse. She needs nice, supportive, cushioning shoes. Number two, she's got to lose weight. She's got to lose weight somehow. She's going to have to cut down on her caloric intake, and she's going to have to increase her activity level. Now, I know her knees hurt, so she's going to have trouble with the walking and the running. She can do other things, as I've mentioned. She can swim, she can do elliptical. She's got to do something to get her heart rate up regularly. And then if those things don't work, she can try other things. There's that visco supplementation that I mentioned, an injection. But start with stopping the high heels and exercise. I think those two things will help her a lot. She'll lose weight, she'll feel better, and her arthritis pain will go way down. Doctor's orders are, don't come to the emergency unless it's an emergency. The reason is, we have to see the people who are dying first. So, if you come to the emergency and it's busy, and you have a stubbed toe, you're just going to have to wait. Now, pain is important. We'll treat your pain, but you won't necessarily get the real treatment that you need until we have stabilized all of the patients whose life is in danger. Keep that in mind next time you're thinking about going to the emergency department.
Now, it's time for you to ask Dr. Zach.
Does anyone have a question?
My name is Drina. I worked in the insurance industry. Dr. Zach, what causes tinnitus, and is there a cure for it?
For people who don't know, it's basically the sensation, the sound, people hear something even if there isn't something there, and it can be constant. Typically it's a ringing, but it doesn't have to be a ringing. It can be all sorts of different sounds, and it can be really annoying to people. One of the important things actually is to figure out what the cause is, and that really is very helpful in terms of the treatment, because if you can stop the cause, you can figure out a reasonable treatment. The answer, there's no medications, unfortunately. There's no really good medications. People have tried different things, but the most important thing really is to get seen by a specialist in the area, and that way they can figure out exactly what the cause is, and hopefully by treating the cause, you can get rid of the tinnitus.
Thank you.
Thank you very much. Anyone else with a question?
Hi, Dr. Zach. My name is Gail. I work in the market research industry. My question is, I've noticed that as I get older, I'm having digestive issues. One of them is with digesting breads. Is this normal getting older? Or do I really have to change my diet around?
So it's a good question. And so I wouldn't say it's normal with getting older in terms of having digestive issues, but it's definitely normal to have changes. So it's not unusual that you can be at any age and suddenly, for some reason, and it's true for allergies too, strangely enough, you can develop them at any age. So as to what the cause is, that's what you really have to figure out. Now, gluten is in the media a lot these days, and people with celiac disease really can't have gluten. But a lot of people who can have gluten have decided not to have it because they feel it has some other effects and it makes them feel not well. It's possible. So it's definitely worth a trial of stopping gluten to see if that helps you. But what I would say is, more importantly, is to try and figure out, first of all, one important thing is to have like a food diary, see exactly what you eat and what symptoms you have afterwards. And then either by testing or by a process of elimination, you can figure out exactly what you're having trouble digesting, and then you can just limit that, so then you don't have to limit your whole entire diet of bread. And that's all the time we have for today. I want to thank my guests for coming in. I want to thank the audience for being here and for some great questions. And don't forget to join us again on the next Ask Dr. Zach.